pleasant good morning and welcome to the Ministry of Health's update on the national COVID-19 response for Wednesday, 12th January 2022. Our panelists for this morning's update are the Honorable Terence Dial Singh, Minister of Health, Dr. Miriam Abdul Richards, Principal Medical Officer Institutions, and Dr. Avery Hines, Technical Director, Epidemiology Division, Ministry of Health. I am Al Alexander, Senior Corporate Communications Officer in the Ministry of Health and the moderator for this morning's update. Dr. Richards will begin with the latest clinical update for the parallel healthcare system. Dr. Richards, good morning.
Good morning. Thank you very much, Al. Good morning to the Honourable Minister, to my colleague Dr. Hines, to all members of the media, and to everyone who has joined in regionally, locally, and internationally. This morning, I'd like to present the update in two parts. I'll start with the information on the COVID-19 dashboard number 966 as of the 11th of January 2022, and then I will provide a brief update on the status of the parallel healthcare system as of 8 a.m. this morning. As per COVID dashboard update number 966, there were an additional 543 cases recorded. This now takes the total number of active positive cases to 16,221. At present, there are 616 patients hospitalized in the parallel healthcare system, and this number accounts for persons in the hospitals as well as the step-downs. I will give you a breakdown of the persons as of this morning. Unfortunately, an additional 20 deaths were reported yesterday, and this now takes the total number of persons who have succumbed to COVID-19 to 3,102. And we extend our sincere condolences to the families and friends of the deceased. The Honourable Minister will provide further information on the vaccination status, but at present our population has a 48.3% rate in terms of full vaccination. I'd like to now shift the presentation to a summary on the status of the parallel healthcare system. This morning, there are 613 persons hospitalized in the parallel healthcare system across Trinidad and Tobago. 480 of those persons are in the hospitals, while 133 are in the step-down facilities. And this gives us an occupancy level of 69%. Now, I'd like to share with everyone that the trends that we speak about in our press conferences have been consistent for the past 85 days. The trends that we have noted include high occupancy levels, which means that the hospitals continue to have many severely and critically ill patients being managed for COVID-19. We've also noticed that in the intensive care units, which take care of our most ill patients, they tend to be most filled. And this morning, across Trinidad and Tobago, the ICU occupancy is 83%. In Trinidad, 63 of the 71 beds are currently occupied, and in Tobago, 3 out of the 9 available beds are occupied. There are 96 patients across the 4 accident and emergencies who are being treated for COVID-19, and at the RHs, being treated for COVID-19, and of those, 23 are ICU level patients. Ladies and gentlemen, the situation in the hospitals in the parallel healthcare system continues to be very serious. we are now proceeding on an 85-day trend. We have the Omicron variant, being introduced through travel into our country at this point in time. And globally, we have seen the impact of COVID-19 and new variants of concern, such as the Omicron, on the healthcare system and ultimately the population. We continue to inform the public of the status of our hospitals so that you can make informed decisions regarding vaccination. Vaccination continues to be a safe and effective way to reduce the risk of being hospitalized, even if you do get COVID-19 and requiring ICU care. We also would like to inform persons and to continue to request that if you are confirmed with COVID positive or you have COVID-19 symptoms, please seek medical attention early and please desist from using medications or therapies that are not approved by the Ministry of Health. Ladies and gentlemen, this brings an end to my short presentation, but as I leave, I would like to continue to encourage you to please take up on the offer of vaccination. Thank you very much, and over to Al.
Thank you very much, Dr. Richards. I now invite Dr. Hines to provide the latest COVID-19 epidemiological update.
Thank you, Mr. Alexander. Good morning to the Honourable Minister, to my colleague, Dr. Abdul Richards. Good morning to members of the media, members of the viewing and listening public. If we go straight to my second slide, I believe it is, we can begin the epidemiologic update. And we begin by looking at those weekly trends that we've been tracking since the start of the pandemic. This current frame shows all of 2021 and the first 2 weeks of 2022 as we progress. And what we see is that the red bars, which are the ones just to the right side of the graphic, are those bars for the weeks in December. We do see that last week in December seemed to have a big drop, but that big drop, as we keep saying, is more likely due to smaller numbers of people accessing care during that holiday period. And what we saw, therefore, is an apparent rebound to more of the on-trend decrease that we are seeing for the first week in January. So that green bar that follows is closer to the height of the bars that we expect around this point in time. So we are seeing a slow and hopefully will be maintained downward trend in the week to week, but we want to juxtapose that against the ongoing looming threat of the introduction of a highly transmissible variant, the Omicron variant, and the potential for large increases as has been demonstrated in other countries. Moving to the next slide, that basically just shows the week-on-week changes and the percentages for those who are keeping track numerically. And what we see is that compared with week 52 of 2021, week 1 of 2022 had a 53% increase. But as we said, that's really just a rebound from those artificially low figures that we may have been seeing in week 52. We will see what week 2 of 2022 brings in terms of establishing a direction for the current trend. If we move to the next slide, we see the same data now aggregated at a monthly level. And what this really shows us is the number of cases that would have been accumulated month by month for all of 2020 and for all of 2021 and so far for January of 2022. Of note, December has had the highest total of cases that we've had for the pandemic, and that's 20,538. Much higher than November, which was the previous record holder. November had 14,032. We will see what the trend brings for January, but to date, with just a week and a half or so gone in January of 2022, we've accumulated nearly 6,000 cases. So the rates haven't dropped significantly, and we do want to continue to encourage the population to adhere to all of the preventive guidelines to help to reduce the rates of transmission. And beyond the preventive guidelines, to adhere to the protective advice and the protective resource that we have at our disposal in the vaccinations. which, as Dr. Abdul Richard said, help both to reduce your risk of hospitalization and your risk of fatality. So we do want to drive that point home yet again. If we move to the next slide, we look at the demographics of those positive, and those haven't changed significantly. Even with the increasing numbers, the shape of this graphic has maintained itself, and we continue to see that the largest number of individuals is in that 25 to 49 year age group, and the male-female balance is just about equal. Right now we have 48.7% men among the positives and 51.3% women. If we move, however, to the fatalities, we do note that the pattern is a little different on the next slide, and that pattern shows that there's a predominance of the fatal outcomes in those over 60, and beyond that, in data not shown on this graphic, we continue to re-emphasize that those risks are higher in individuals with pre-existing comorbidities, and also the risk is higher in those who are not vaccinated. So we want to continue to encourage those who have been vaccinated and who are due for their boosters to make sure to get your booster as scheduled to keep that immune response as strong as possible. Those who have not yet been vaccinated, we want to encourage you to be vaccinated, as it reduces your risk of death significantly. And as we look at the threat of a highly transmissible variant getting into the population, we do want to take every precaution that we can to reduce our own personal risk and the risk to those around us. So with that, I'm going to conclude the epidemiologic update and turn you back over to Mr. Alexander.
Thank you very much, Dr. Hines. And now Minister Dayal Singh will provide us with the latest vaccination figures and address current issues relating to the national COVID-19 vaccination campaign.
Thank you very much, Al. Good morning to Drs. Richards and Dr. Hines. Good morning, ladies and gentlemen of the media, and all persons viewing and listening wherever you are. Good Wednesday morning. I'll start off by just giving the vaccination numbers updated as of last evening. Persons who have access 2 doses of a 2-dose vaccine or 1 dose of the one shot and done J&J vaccine, 677,025 persons, which represents about 48.4% of the population. So we are going up in increments of 0.1% per day. Yesterday we did notice a slight dip. We were averaging roughly between a Monday and a Friday of around 1,600 doses per day. Yesterday we dipped to 1,302. Let's hope this is not the start of a pattern, but let's hope this is just a blip on the screen and that we could get back up to around 1,500, 1,600, 1,700 and hopefully as much as 2,000 a day. So we could increase in increments of more than 0.1% a day. 0.1% is about 1,400, considering a population of 1.4 million. The numbers of persons who have accessed their booster shots, that continues to climb by about 2,000 a day, which we are grateful for. It's now 94,254. The number of public sector officers who we are tracking at the 2 sites dedicated to public officers at the campus, Government Plaza campus and SAPA, now stands at 1,596. So that's a good sign. But remember, some public officers are accessing vaccines at other sites where we are not tracking that particular data. So that is the state of play with vaccinations. Could I have this slide about the booster program, please? I want to reiterate to the public the need to be boosted. And the need to be boosted is particularly important now with the global threat of the Omicron variant, which, for those who are paying attention to international news, you will see the Omicron variant is surging dramatically in other territories. Countries are seeing COVID positive cases that they have never seen in 2 years. We are now, in some countries, reaching new heights that have never been reached before. And all the evidence is suggesting that one of the best ways to protect yourself against the Omicron variant is to be boosted. So the message is, for those who have already received their vaccination schedule, whether it's AstraZeneca or Sinopharm, between the 1st of July to the 30th of July, your schedule started on the 8th of January and will run until the 5th of February. All of this information has been published in the newspapers. It is on the Ministry of Health's website, and we have blasted it or put it out on social media. So for those who receive AstraZeneca and Sinopharm between the 1st of July to the 30th of July, please go and get boosted as soon as possible as the schedule allows. For Johnson & Johnson, if you received your dose between the 7th of November and the 7th of December, you can go and get boosted again between the 8th of January, which we started last week Saturday, and the 5th of February. And you can be boosted with either Johnson & Johnson or Sinopharm. If for some reason a person in the last cycle missed their timetable to go in during the month of January to be boosted, you are quite welcome, and we encourage you to come in and still get boosted. So the simple message is, if you missed the scheduled weeks that you were supposed to be boosted in January, come in and get boosted. And for those who are due to be boosted between the 8th of January and 31st of January, and the 8th of January to the 5th of February, come in and get boosted. Boosting, it has been proven worldwide to be effective at giving you that further layer of protection, especially with the Omicron variant. So please come in and get boosted, and I'll thank you very much, and we can now take questions.
Thank you very much, Minister. So, our media representatives are reminded to state their name and the name of the media house that they represent. They would be invited to pose 2 brief questions in the first instance. Please identify the panelists to whom you wish to address each question. Time permitting, we will accommodate a second round of questions. Please note that during this segment, we will be taking a few questions submitted by the Media Association of Trinidad and Tobago relating to the national COVID-19 campaign. We will take our first question from the Newsday.
Right. Morning. Clint Chantak of Newsday here. My questions are for anybody on the panel who can answer them. Firstly, is there any sound or scientific justification that you could find regarding the call by NATA to close all COVID-19 safe zones, because they are contending for some reason that this is actually increasing the spread of COVID rather than the opposite? And secondly, at an event that they hosted yesterday, they brought forward 3 people who claimed to be experiencing adverse effects from COVID-19 vaccines. So, in that context, are those cases, concerns of these persons, have they been confirmed to be legitimate? And is this perhaps some kind of subtle way of pushing a non-vaccine type of agenda rather than raising genuine concerns?
Thank you, Chris. Dr. Hines?
Okay, with respect to the first part of the question, there is no logical or scientific basis on which to make the claim that the measures to reduce risk during public interaction would be conversely increasing the risk of transmission. What you would see is that if the measures aren't adhered to, if the people trying to find loopholes to escape the various requirements, that would increase the risk. But we are going to hope that those aren't in the majority, and to re-emphasize that all of the requirements for the operation of a safe zone are basically added layers of protection to reduce the risk of an infected individual being in a gathering space in the public, while trying to allow for some measure of economic activity and social activity in the midst of the pandemic. So any attempt that we make, any restrictions or requirements that are put in place to reduce the risk of positive individuals interacting cannot lead to an increase. So that the science behind that doesn't really make a lot of sense. Now, I'll let the Minister respond to the second part of the question.
Thank you. I just want to add something because you asked a very good question about NATO's call to close down safe zones. I would think as a country we are happy that people are being employed in safe zones. I think as a country we should be happy that we are finding ways, as we say, to live with the virus, to coexist with the virus. I was quite taken aback by that call because who is going to pay the rents? Who is going to, put food on the table if we take that call to shut down safe zones? So it's a matter of, if I could paraphrase what Dr. Hines is saying, risk and reward. And at this point in time, the reward of having people employed in a safe environment far outweigh whatever risks there are. To the other part of the question, because you phrased the question properly, was this genuine or not? So first of all, if it is genuine, we express our concerns, but we have no way of knowing because no medical evidence was put forward. There was no doctor's certificate. There was no medical evidence put forward. And that is complicating the conversation, unfortunately. And I am hoping that the same way causation was tried to be made with two early deaths, a gentleman from Princestown and Franklin Can, trying to unfortunately link their deaths to the vaccine, which was mentioned in an MFO report as leading to vaccine hesitancy. I am hoping that these unconfirmed reports, and what we would appreciate is the medical evidence, the doctor's certificates that demonstrate or that make a causal link. And when I'm finished with my answer, I want Dr. Hines to talk about the difference between correlation and causation. Because just because two things happen close to each other, which is correlation, does not necessarily mean causation. So he will talk a little bit about it. We do have at the Ministry of Health, and have had for decades, a reporting system to report adverse events brought about by vaccination and immunization. It is not new. What is new is the public interest in it, for which I am happy about. So there are three pathways to which we trace these events. Path one is something called ESAVI, E-S-A-V-I. It's an acronym which simply means events supposedly attributable to vaccines or immunization. We also have another pathway, AEFI. This is coincidental events and adverse events of special interest, AESI. How do these systems work? There are three pathways that we track this over the decades, but as I said, because of COVID vaccines and the renewed interest. So if a patient has come down with any adverse event, not side effect, not necessarily pain at the injection site or simple fever which is resolved, adverse event, private sector doctors over the years report that to the county medical officer of health. Those reports then go to Dr. Hines's unit, National Surveillance Unit, and it is copied to the expanded program of immunization. It also goes to the chief medical officer and PAHO. And depending on if what is being manifested by the patient is an unusual adverse event not listed in the literature that is put out, it is also reported to the manufacturer. So that's the private sector pathway. In the public sector, if you go to an A&E or a clinic, it will be reported in the same fashion through the A&E, the Community Liaison Unit, the Public Health Observatory. It goes to Dr. Hines' unit, and so on. So there are clear pathways for any patient who suffers an adverse event or an unusual adverse event that the doctors and nurses in both the public sector and private sector can send these reports and they will be treated with. So what is interesting is that I am not doubting the veracity that something may have happened, but in the absence of a medical certificate stating what has happened, it is difficult to make a determination. I will now hand over to Dr. Hines to further clarify the difference between correlation of two events and causation.
Okay, thank you, Minister. I believe you did a creditable job in making the initial distinction, and that is really that you may have two events that occur in relative proximity with respect to time, one happening after the other, but just because that's the sequence does not mean that the thing that happened first necessarily was responsible for the thing that happened second. And what would be needed in order to establish that causal link would be really some specialist review of the sequence of events, the types of symptoms, the actual unfolding of the medical event, and the test results that would suggest whether or not this is actually related to the pre-existing vaccination event or not. So there's a lot of additional specialist review that would be required to make that sort of determination. Nonetheless, once something like that is reported, it is clearly one of the things that will be investigated. But while that is happening, what we would like to encourage is that individuals do not take these reports, unconfirmed or otherwise, as a reason not to access the vaccination program. Because, as I believe you had pointed out recently, we've had more than 1.3 million vaccine doses administered in that time frame. And by contrast, we note that 3 in maybe every 100 individuals who get the virus will have a fatal outcome. So if we have a small number of adverse events that haven't yet been confirmed out of 1.3 million, it is clearly much of a higher risk to have the virus than to have the vaccine. And we want to encourage people to continue to be vaccinated because it's definitely providing protection against serious illness and against death.
Thank you very much, Minister and Dr. Hines. We move to TV6 for your questions. Good morning. Good morning, Alicia. Good morning.
Good morning. I just want to follow up on Clint's question. Now, Minister, you mentioned the absence of a medical certificate and so on. But one of the claims made by one of those persons would have been she tried to get health officials to report the matter as an adverse event, and they refused to do so, so much so that she had to reach out to Pfizer herself, and Pfizer responded. So I wanted to find out, should we be concerned at least about that claim that that event or those events were not being reported to PAHO and WHO, and what could be some of the reasons as to why health officials would not report such incidents? So that's my first question. Second question is based on that NATAC press conference as well. Mr. Anisette called for a vaccine compensation fund, Minister, well, the establishment of one at least, and I wanted to find out what is your take on that. Thank you.
So let's deal with the first issue. Again, I just want to reiterate that I do not doubt that something may have happened. But in the absence of confirmation, it is difficult or near impossible to verify the claims being made. Whether the claim is that the vaccine did A, B, or C, or whether the healthcare professionals did not do their job. It is impossible for me. What I can say is that if you have the names and addresses and phone contacts of those individuals, we will be more than willing to contact them and uncover the facts. I think facts are important in dealing with this rather than claims. I am not downplaying it. We take it seriously, but we need the facts of the matter. So that's my response to question number 1. On question number 2, this is not something that I will say yea or nay to on the air. This is something that the government will have to consider, look at the merits, demerits, and proceed. But the conversation now, and it's unfortunate that with 20, 30 deaths per day, the conversation in this country is not about getting more people vaccinated. We have had no known deaths, and I just did a rough calculation. Between first dose, second dose, and boosters, we have administered 1,444,171 doses of vaccines. 1.44 million. 1.44 million with no deaths attributable to vaccination. But every day, 20 and 30 people are dying. So unfortunately, the way the conversation is now being framed in the public domain is that vaccinations are something not to be trusted. And I don't know why that agenda is being pushed, but the clear evidence around the world is that vaccination does 3 things. Because people are asking for guarantees. There are no guarantees. What vaccination does, and the promises of vaccination is 1, it significantly reduces your chance of being infected and being able to transmit. 2, significantly decreases your chances of ending up in a hospital and an ICU. And 3, when you look at the dashboard we print every day, the last tile shows you that the vast majority of deaths are amongst the unvaccinated. So if I could use this opportunity, Alicia, to respectfully ask that we all reframe, R-E-F-R-A-M-E, reframe the discussions about the beneficial aspects of vaccination. It saves lives. And with the Omicron variant, it is showing that boosting is now necessary. We need, as a society, all players and all members to be pulling in the same direction, because we are in a tug of war with the virus. We are pulling one way, the virus is pulling another way. But if all of us don't pull in the same direction against the virus will win. The virus will overcome us. The virus will overwhelm the healthcare system. Lives will be lost, livelihoods will be lost. So if I could just ask the national community and every player, every leader in the national community to pull together against the virus and frame our conversations around the beneficial effects of vaccination, the fact that we must continue to wear masks, because I am noticing when I walk and drive through areas that the general population seems to be tired of wearing masks and social distancing and so on. But those things are still important. And there's a growing worldwide tendency amongst the vaccinated, not only in Trinidad and Tobago, to think that once you are vaccinated, you no longer have to wear a mask and take precautions. No. If I could just give you an analogy, and I'm sorry to be so long, but I think it's important. When we travel abroad to the wintry countries, you put on layers of clothes. You don't just put on a jacket alone. You put on a shirt, a sweater, you layer up. So think about the public health measures as layers to keep you warm, but then your final protection, that heavy coat you put on, that is vaccination. So let us layer Three W's, vaccination, and we could do very, very well with this pandemic. Thank you very much, and I apologize for being a little bit long, but I think it needed a long answer. Thank you very much.
Understood, Minister. 103 FM, we're ready for your questions. Good morning.
Good morning, everyone. This is Sira Chandu from 103 FM. Both my questions are for the Health Minister. First of all, is the Health Ministry or the CMO's office regularly following up or checking on these private labs that are accredited to do PCR testing? The reason I ask is we have a report of a lab mixing up results. So the lab sent the person a positive result, but called and said that he was 100% negative. When he persisted in asking if they were sure, they did a check and admitted to an error and that he was indeed positive. My second question, there are citizens who do not have ID or even a birth certificate. So what do these persons do if they want to be vaccinated? Thank you.
Thank you. So again, the issue you raised about this one person, it is difficult to verify that type of claim. What I suggest you do is send us, you could send it to Al, the name and phone contact of that person, and we could verify. There are 11 private labs, I believe, that are doing COVID-19 testing. It is impossible for me to say what may have led to that. It could have been a false positive or false negative administrative error. But I cannot here be judge, jury, and executioner and say the lab was at fault because I simply don't have the information. So if you send it to us, we can do that. What was the second part of the question?
Persons who don't have IDs and want
Yes,
to be vaccinated.
we are vaccinating persons without IDs because we recognize there will be persons without IDs, and it's more important to vaccinate them than to stand on ceremony and be overly bureaucratic. So you can be vaccinated without an ID, as we have been doing, okay? But those numbers are fairly small. Thank you.
Thank you, Minister. And Ms. Chandu, you can send your email to corporate.communications@health.gov.tt. With that, we go to azpnews.com. We are ready for your questions.
Good morning, Prior Bihari, azpnews.com. My first question is for Dr. Hines, and my second question, if I'm already panel. There are concerns, Dr. Hines, that the 21-day quarantine period might be a bit too long because people who initially test positive, they are negative long before that. And then secondly, people who are primary contacts and in quarantine, they feel that they're waiting too long to be released. Can anything be done to get that period, a much shorter? And my second question, there was a study done in Singapore where the people who had passed away due to COVID-19 and the type of vaccines that they took, who were fully vaccinated and passed away. And what I found was that the mRNA vaccines seem to be more effective as opposed to the ones with the old technology. Is that a concern for Trinidad and Tobago, and is the ministry looking at that issue? Thank you very much.
Okay, thank you for the two questions, Mr. Bihari. With respect to the first, we continue to review the evidence, the data, globally, internationally, on the durations of infectious periods and the durations of incubation that have been demonstrated as the pandemic unfolds. The isolation period for those who are infected has been set at 21 days, really to minimize the possibility of someone who is still infectious, meaning shedding virus, being out and about and continuing to contribute to the spread of the virus while they are ill, even if they don't feel ill. Now, people may test negative prior to that, but as the WHO itself has actually pointed out, the best use of the testing resource at this point in time is not to utilize it for out-testing, as in testing to release individuals from isolation. So what you do is you create a system that may err on the side of caution, but reduces the risk of infectious people moving around to the greatest extent possible. We continue to review the data. If there's enough evidence to suggest that we would want to shorten the period based on the international information, then the period will be adjusted accordingly. That's a continuous review process. Similarly, for the period for which individuals are quarantined, when you are exposed, not yet infected, but you're exposed to an infected person, you have the possibility of becoming infected yourself and of manifesting symptoms or a positive test. And the time frame during which that is likely to happen extends to as far as 14 days. Therefore, the quarantine period matches that incubation period for the virus, and you are asked to remain out of circulation pending that potential development. So again, as we look at the data, if there's any evidence to suggest that it is safe to shorten that period without increasing the risk of transmission, then those adjustments will be made. But they're not unnecessary, and just because people feel inconvenienced by them doesn't mean that they're suddenly not valid. Now, the second question, with respect to the mRNA versus other vaccines, I think the best answer to that is that whichever kind of vaccine you have, the response of your immune system is strengthened by getting your booster. So once you've been vaccinated, you reach full vaccination, whether it is with the mRNA, whether it is with the killed virus, the whole virus, whichever vaccine is available and is given to you, your effectiveness is going to be boosted by continuing with the booster schedule. And therefore, the concern that may arise from whether or not one or the other gives you a longer protection is mitigated by the fact that there is a booster program and there are enough vaccines to provide boosters to all those who have been vaccinated. So we can keep that protection going, and we encourage individuals to continue to follow with the schedule, with the initial doses, with their vaccination, with their booster vaccinations, to maintain the best possible outcomes.
I just want to add to what Dr. Hines is saying. Prior, I'm looking here, Singapore's health minister, Ong Ye Kung, he said, be mindful, responding to your question about the report. This is not a scientific report, and these are his words. These are the words of the health minister of Singapore. And it's so unfortunate the way the national conversation is being phrased. He says, be mindful. We are calculating this based on quite a small sample of 247 deaths. And this is the key line. These rates are only indicative since they do not account for other factors which can affect mortality, such as the age and timing of vaccination. So, ladies and gentlemen, I just want to urge us, when we are reading reports, not to cherry pick something to fit a narrative. Look at the entire report and let us make reasonable conclusions and not assumptions. And these are his words. These are the words of the health minister of Singapore. Be mindful. We are calculating this based on a small sample of 247 deaths. And Dr. Hines could tell you, making assumptions based on small numbers is actually quite counterproductive. And it is worth repeating. The rates are only indicative, not conclusive, indicative, since they do not account for other factors. So you have to consider everything prior. So please, I really appeal to us when we are reading these things, that we read them in the round and not make conclusions which cannot be supported by the evidence. Thank you very much.
Thank you, Minister. We go to Guardian Media Limited. We are ready for your questions.
Good morning to the panel.
Good morning.
So my question is to the Minister of Health. So yesterday, Guardian Media carried a report that pharmacies were selling rapid antigen tests to the public. Now, I know that's 1 week after you announced that importers could send requests for approvals. So my question is, were approvals for this sale given by the Food and Drugs Division in less than a week? And if not, how this pharmacy was allowed to sell these tests? Also, the pharmacy board had yesterday said a wholesaler already had the test. So I wanted to find out from the Minister of Health whether or not he received this report, and if not, how did it get past customs?
Okay, so the issue of customs is not under the remit of the Ministry of Health. Customs is under the Ministry of Finance, so I wouldn't be able to answer that. As I have stated several times, the process for registering rapid antigen tests is a very simple process. It could be done in a couple of days. My information is that Chemistry, Food and Drugs has in fact approved rapid antigen tests maybe a week or two ago. So if it's that rapid antigen test, it is legal. It is legal for sale. So that's the information I can give you at this point in time.
Thank you, Minister. We quickly go across to the Express. We're ready for your questions.
Good morning, Kim Bojram from the Express. Minister of Health, but also either doctor is appreciated to weigh in. First of all, just to come back to the vaccine issue, Minister, why we do have an adverse reporting effects thing in place, and that's a requirement. But Trinidad is, we are not unknown for any type of medical strides out there in the world. Why not establish something that is a little more, when I say personal to Trinidad, a research center that could take on these types of cases? Because the media does get a lot more reports, and people are not always willing to come forward, as these three other young people were, and make themselves public, but they're claiming to have these severe and, well, less severe adverse effects from vaccines. So why not establish something that is our own, that is would put us eventually in a better position to give better answers to people like this? Also, the antigen testing kits, they are out there, they are becoming available. A very specific question about that is happening. What happens when people there's a margin of false and positive results, of course, with those. But what happens when people are getting positive antigen tests at home and negative PCR tests when they test, mostly privately, that I'm aware? What advice to give to people like that? Because there's a perception that there's a move away now from PCR tests towards the antigen test in terms of reliability. It's causing some confusion. So I was hoping for any kind of clarity on that.
Thank you. So we have a lot to get there. So I have a different perspective. We started off by saying we are not renowned for medical advancements. I think the doctors in our public healthcare system and private healthcare system will have a different view. We have pioneered a lot of medical procedures over the years. I wouldn't go into them. The reporting system is a global system. We are part of a global community. What you don't want is individual countries setting their own standards, because all of this information has to go to a global repository. That will defeat the purpose of having a global monitoring system. The system is robust. The system has worked for decades. It is just that, as I said, with the COVID-19 vaccine, it is in the news, but these systems are part of a global monitoring system, and that is what we do. We are part of a global system that reports adverse events up the chain to PAHO, WHO, and the manufacturers if need be. On the issue of rapid antigen testing, I don't know if Dr. Hines wants to come in here, but I have said, and we have all said, that the gold standard for testing is PCR. But there is a place for rapid antigen testing. However, the advantages of rapid antigen testing is: one, price, it's relatively cheap. Two, it's quick. But what you get for that, you sacrifice in accuracy. And what we ask people to do, especially if you get a negative, because they are prone to false negatives, is that you follow it up with a PCR. So I'll turn over to Dr. Hines to give you a more technical answer on that.
Okay, what's important to note with the different forms of testing is A, when you use them, and B, how you interpret the result. And one of the important things to note specifically about the rapid antigen test is clearly it performs better in individuals who are symptomatic in giving you an indication of what could be happening with this individual at a given point in time. If you're symptomatic, meaning you're having any of the symptoms that could possibly be COVID, you have a rapid antigen test and it's negative, it doesn't mean we'll ignore the possibility of COVID and go about your business. You still would want to then continue on to have some confirmatory result with the PCR so that you can be guided accordingly. And even in the absence of any test result, if you're symptomatic and having deteriorating signs, deteriorating symptoms, with or without either a PCR or a rapid test, we would encourage you to seek healthcare where they can provide A, support for you, and B, the relevant confirmation. So you're not being guided strictly by test results, but you're also being guided by the clinical condition of the patients. And just to reiterate that all of this is in the context of interpreting that epidemiologic situation. Is the person symptomatic? Were they exposed, etc.? So there's a lot that is factored in beside the test result in making a decision on what to do next once you have tested. And this is why we seek the guidance, we encourage the population to seek the guidance of the health professionals in both interpreting and then in responding to whatever result they have from whichever test they have done. So I'm hoping that provides a little more context in terms of the testing.
Thank you very much, Dr. Hines. We'll now move to address some of the MAT questions that were sent to us. First, if COVID-19 can spread from dry spit, the concern is people spit on the streets all the time. Can COVID be spread in this way? Dr. Hines, you'll take that one?
Okay, I think I will take that one. It's an interesting question. It's one that we had addressed quite early on in the pandemic with regard to the existing public health laws against what we call public expectoration or spitting on the streets. The regulations that have been in place since tuberculosis was a concern. Yes, spitting on the streets is A, nasty, and B, against the public health laws, and it should be discouraged. But this may not be the most important factor in terms of the public spread of COVID-19 at this point in time. So while it is something to be discouraged, we still need to focus importantly on contact with ill people and the hygiene around touching potentially contaminated surfaces that would be really a little more germane to the discussion of risks of transmission. And here we want to re-emphasize those 3 W's. The mask wearing reduces the risk of you putting droplets into the air. And if you have a mask on, then you can't spit on the pavement. The second thing is the hand washing, which reduces the risk of touching contaminated surfaces, and the watching your distance. And on top of that, of course, we want to continue to encourage vaccination, which reduces the risk of being A, infected, B, ill, and C, having a fatal outcome. So yes, there's minor concern around that, and there is a law against that public expectoration, but let's keep focused on those 3 W's and the very important V.
Thank you, Dr. Hines. I want to invite the Minister to add to the response.
No, I'm fine.
Okay. All right. Okay, so we go to the next question. There's speculation that a young woman who had been hospitalized for 3 to 4 months after taking the vaccine died yesterday. It is said that she became paralyzed from the vaccine. Is this true?
No such report has reached any of our offices through any of the channels that the Minister would just have outlined in some detail. Of course, if additional information is available and you wish to provide that through the reporting channels, including through the Corporate Communications Division, then you're free to do so, and any such information will be followed up and investigated accordingly.
Thank you, Dr. Hines. And again, the email contact is corporatecommunications@health.gov.tt. We move to another question. Has the Ministry of Health been contacted with respect to the reopening of the beaches in Tobago and the concerns of reef tour operators in light of Tobago's tourism thrust?
Thank you. I think that one falls in my side of the court. Yeah. So Trinidad and Tobago beaches across both islands are currently open from, I believe, 5 a.m. to 12 noon. All beaches across Trinidad and Tobago are open. It's one country. and all beaches are open from 5 a.m. to 12 noon. Take advantage of it. What we are trying to do is to prevent the congregation that tends to happen on evenings but you know what happens when the sun starts to go down, and especially with the Omicron variant, we have to be careful. So go and take your sea bath, whether it's for exercise, just to decompress, whatever, it's good. On the issue of reef tours, that is something that we are always looking at to see which sectors of the economy can be opened up. And we continue to monitor all of these things so that we could put people back out to work, but in a safe manner that will not overwhelm the healthcare system, right? So thank you very much, Al.
Mr. And our final question. There has been a debate on the length of days after testing for the COVID-19 virus before the virus is detected. Has there been a shift or variance in the number of days of quarantine and the number of days the virus is detected after testing?
Okay, so I think we addressed that partially when Mr. Bihari's question was answered. Now, one of the things that this question focuses on is the time frame between you becoming infected and you having a positive test. And that really just emphasizes the importance of that incubation period that we have you quarantined for, the period during which you may be infected and subsequently become infectious, but initially your test may not show up as positive. So no, there hasn't been a shift for all the reasons that we have just described and explained in detail, but we continue to look at the data internationally, and if there is evidence for a change, then changes will be made accordingly.
Thank you, Dr. Hines. And that's all the time we have for question and answer segment. We thank the media for their engaging questions, our panelists for their responses, and you, our viewing and listening public, for tuning in to this update. In closing, we ask that you please continue to protect yourself and your loved ones. For up-to-date and reliable information on COVID-19, please go to the Ministry of Health's website, www.health.gov.tt, or visit our social media handles. If you haven't received your COVID-19 vaccine as yet, please get yours now. Don't delay. Get vaccinated today. We do have two testimonials, which we will show right now. But for now, from our panelists, we say goodbye.
Hi, I'm Anastasia Blackman from Mayaro, and I took the COVID-19 vaccine because I miss my social life. I would soon like to get back to some form of normality.
Don't delay. Get vaccinated today. A message from the Ministry of Health.
My name is Anne-Marie Paul Roberts. I live at Torib Tabakit Road, New Grant, and a member of the Brothers Road Chronic Disease Exercise Class. I took the COVID-19 vaccine because I believe in the science and was afraid of getting sick and hospitalized for COVID.
Don't delay. Get vaccinated today. A message from the Ministry of Health.
Hey, yo, your boy Tim here again. This time we came to a public park just to ask, what is people's why? Why did they take the COVID-19 vaccine?
Yes. I call him Norman, you might call him Osh.